And we're joined by Dr. Michael Humer, the BC United Party candidate now in this new Kelowna Center riding. Exciting times for you.
It is extremely exciting times. It's a beautiful day, and thanks for your interest today.
You were saying that you're different. You know, just before this interview, that you're not your typical political candidate. How so?
Well, I come at it from perhaps a different bent. I consider this a critical time in British Columbia for all British Columbians where there's major issues affecting them, and no less in Kelowna, and specifically in Kelowna Center. So my background, as you say, is in healthcare. I've had a career dedicated to surgery, thoracic surgery, serving the people of the north and the interior. And I've learned a lot of lessons through that. And now is the time where I have to step forward and continue my public service, moving from healthcare into healthcare and other issues at a provincial level. So
that's a radical change from,
Well, I've been blessed. I love British Columbia, and for the last 20 years we've lived in Kelowna, and I'm passionate about this community, passionate about the interior and the whole province. And I guess the rational change is that I've been so lucky and beneficial by what I've been able to experience, and I want to continue that work. So really, my career's been about public service, and now I think I need to step forward in public service at this level.
This is a fascinating new riding that they've created here with no track record. Typically, when you take the urban core of a city, it kind of leans more left than the countryside. So who knows how this one goes? You might have to really campaign hard to win this one.
I look forward to campaigning very hard. This is an extremely exciting opportunity for Kelowna. Kelowna's grown from having 3 provincial ridings to now 4 provincial ridings. And that's because of the growth in Kelowna and West Kelowna. And their new Kelowna Center riding will be an amalgamation taking components that used to be in the West Kelowna riding, also the Kelowna Mission and the Kelowna Lake Country riding. And as you say, we're sitting here in the middle of Kelowna Center, and it's a riding that is new. And it's a great opportunity for me because my career has always been about listening to patients, because ultimately I work for them, listening to patients and working with them collaboratively. And this is my full-time endeavor now, and I want to get out and listen to people, talk to people, learn from them. I have some ideas about what we need to do. I have some ideas about what the issues are, and I'm going to advocate with the BC United in terms of making those things more successfully managed. However, my goal will also be about getting out, meeting the people, finding out what their issues are, what matters to them.
When you think about big issues facing this province right now, is there one or two that come to mind that kind of...
Well, the major issue, obviously we'll get to healthcare because that's where my expertise is, but it has to be the cost of existing, the cost of living, the cost of housing. And then there are other issues around drug and addictions, and also about safety, and then healthcare. And the fascinating thing is, they all really interrelate. They all really interrelate, and they're about serving people, serving the individual, getting government to be there when necessary, but actually getting results and working on behalf of the people. So those are the issues. And obviously healthcare is in significant trouble right now. I'm absolutely believe that healthcare can be fixed. Public healthcare can actually succeed. However, what we need to do is continue to get the patient's voice in there and the provider's voice in, that they work for the patients and continue to serve the patients. What do patients want? Patients want access to services, access to care. They can get incredible care when they get it, but they want access to that in a timely, efficient manner, and they want it delivered in a quality fashion. And the similar on other issues. So the fascinating thing about Kelowna Center, it's an amalgamation from the previous ridings. It's right in central Kelowna. It has urban issues, it has rural issues, so it's going to be a fantastic experience meeting the people of Kelowna Center, learning about what their issues are and representing them.
So what was the process for you to get the nomination here? That there didn't end up being a nomination vote?
So I have been encouraged and worked with BC United for me to understand what they represented, to make sure they represented what I believed in. And I fully endorse BC United and Kevin Falcon. Kevin has a tremendous track record of leadership in public service, also in the private service, about getting things done. And he has a great legacy. He talks about the legacy, and we can look at the Bill Bennett Bridge, which he was involved in getting. So I worked with the BC United to find out whether they would work for me and I would work with them. And I absolutely am behind them. And then there was a vetting process for a long period of time. And then they decided that they supported me to the degree that they wanted me to be the candidate in Kelowna Center. New riding, bring my healthcare experience and experience on other issues into the provincial forum.
Terrific. And before this interview, you said you promised to stay in touch with us, right?
Absolutely. I want to use you as a conduit to seeing people. And I will be out in the riding. I walked over here today. I live in Kelowna Center. I will be walking around the riding around the riding, and I will be out seeing people and getting their voices into the conversation.
So if I say, whoa, hang on, Dr. Humer, get back here, we got to talk again, you're ready to go?
I'm ready to go.
Terrific. Thanks for this.
Thank you very much, Kent.
And thanks for watching Kelowna Now.
Okay, take care.